As an undergraduate student at Graceland University in Lamoni, Iowa, I wasn't very interested in research. In fact, I wanted to be an applied sports psychologist. However, my professor, Dr. Carey, had other plans for me. Through her excellent instruction and encouragement of my psychology applied research project, I gained a love for research. My undergrad degrees were in psychology and sports science. I went on to get a master's degree in educational research and psychology with an emphasis in sport and exercise psychology, and a PhD in health psychology and educational research at the University of Missouri, Kansas City. While there, I not only got to apply my sports psychology knowledge with the track and field and cross country teams, but I also got to help conduct a variety of research studies. I also completed a postdoctoral research fellowship at the University of Missouri, Kansas City, where I managed a large, funded, multi-level community health study focused on obesity, including staffing, logistics, and data quality oversight. I coordinated a team of data collectors, daily data entry, and quality control processes across 21 census block group areas where we measured every non-residential land use and then analyzed how what was in the area was related to the obesity levels of the people who lived there. I also wrote my first peer-reviewed publications and gave my first research conference presentations during this time. My primary research area is health behavior, or understanding how we get the population to do more healthy behaviors and fewer unhealthy behaviors. I've done a lot of survey research, collecting survey data in person during my postdoctoral fellowship and on paper or online since that time. I've helped develop and conduct assessments of the built or person-made environment. I have conducted a variety of qualitative studies, including interviews, focus groups, and even photo voice projects, where the primary data were words and photographs that I analyzed qualitatively. At Kansas State University, my research lab was a CrossFit gym, and I conducted quite a few applied exercise interventions with youth, older adults, cancer survivors, and overweight and obese adults, military personnel, and healthy adults. I studied the mental, social, behavioral, physical, and physiological benefits of the exercise programs. More recently, as a part of the research and evaluation team at a nonprofit, I researched the positive outcomes experienced from participating in sober community activities, including flourishing. I've also done secondary analyses of existing data, and I've mentored students in my research lab in that process as well. Finally, I've collaborated with international teams of faculty members and undergraduate students in the process of replicating exercise studies with nutritional supplements. I have over 150 peer-reviewed publications. What you might find most interesting is that all of them were collaborative manuscripts that I published with one or many co-authors, including a lot of students. I've published in a variety of different journals, and I have reviewed other researchers' papers for over 90 journals. A notable contribution is that I've helped author a chapter on mental health and brain health for the last 2 editions of the American College of Sports Medicine's exercise testing and prescription guidelines. One presentation I really enjoyed was an invited presentation at a symposium on strength and endurance training at the University of Jyväskylä in Finland on the theoretical basis of CrossFit training, where I was able to network with researchers from all across Europe. I also had the chance to be the keynote speaker at a research scholars showcase at Graceland University, where I completed my undergrad degree. I've had or been part of a lot of different grant-funded research, but one highlight is a 5-year, $2.52 million grant I had funded by the National Institutes of Health. We worked directly with military personnel, mostly the U.S. Army, to compare 6 months of CrossFit training to standardized Army physical readiness training. We learned that both programs helped improve fitness, but the soldiers really preferred the CrossFit training. Interestingly, since that time, the Army has changed their combat readiness testing protocol, and their new tests are very similar to those that we used in our study. I mentored 65 students in my research lab at Kansas State University. Many of them received funding for their own research projects, presented at research conferences, won research and travel awards, and led or co-authored peer-reviewed publications. My undergrad students have gone on to medical school for DO and MD programs, nursing school, physical therapy school, and a variety of academic graduate programs to earn master's or PhD degrees. I work closely with students to identify their own interests rather than telling them what to choose for their research projects. Research takes a lot of time and effort, and it helps if students are passionate or at least really interested in what they're doing. I use a structured and collaborative approach with students to develop clear goals and expectations, as well as breaking the research down into achievable steps. I encourage personal and professional growth by setting high standards, but providing accessible and supportive help along the way. Most importantly, I treat students as people with full lives, of which research is only one part. I'm happy to work with students so that they can succeed no matter what life throws at them. I've worked with many different students who have unique learning and working styles. As such, I've developed a lot of different strategies to support students over the years. I am a very determined person, and I enjoy seeing others succeed. One strength I have as a research mentor is to make sure that students do not take on more than they should in a research project. Another strength is that I schedule regular check-ins with students and provide constructive and not overly critical feedback. It's important to point out things that students are doing well and then give them the tools to improve what might not be going so well. I really enjoy the process of mentoring. I love it when things click into place for a student and they develop their own love of research. I know I have done a good job when a student goes on to share their knowledge and mentor others.